Many of us take drugs and medications without question, not really wondering or knowing why they work. Well, have you ever heard of action potentials and neurotransmitters? Well, whether you know what these are or not, your body sure does. Your brain and nervous system are composed of billions of functional units called neurons, which communicate by using electrical signals called action potentials and chemical signals called neurotransmitters. Each neuron can generate anywhere between 5 to 50 action potentials in a single second, and a single action potential can stimulate the release of a variety of different neurotransmitters. How do neurotransmitters and action potentials work together to communicate things to your body? Well, let's take a look at a neuron. Dendrites protruding from the cell body of neurons are where chemical signals like neurotransmitters are received and translated into the neuron. There are so many different types of receptors on dendrites that neurotransmitters bind to. When a neurotransmitter binds to a receptor, it sends a signal to the cell body of the neuron. When a neuron is stimulated enough, it will initiate an action potential that will be sent down the axon, causing more neurotransmitters to be released from the axon terminals and sent into the synapse between the previous neuron and the next one, continuing this message. If an action potential doesn't continue to be sent, the neurotransmitters left in the synapse will be degraded or reuptaken back into the axon terminals, so they don't keep acting on the receptors of the dendrites and sending more signals. Drugs work by interfering with these signaling processes. There are a few different types of drug classes that interact with these processes a little bit different. First up are agonists, which work by mimicking a natural neurotransmitter. They fit into the receptor site and allow for a signal to be sent, despite the natural neurotransmitter being absent. Opioids like heroin are an example of agonists. They fit into the receptor site where endorphins would, sending signals that cause pain relief and euphoria. Next up are antagonists, which work sort of similarly to agonists by fitting into a receptor site, except antagonists block the active site, preventing the binding of neurotransmitters or drugs and thus preventing signaling. Naloxone is an antagonist used to combat opioid overdose. It has a stronger binding affinity for the same receptors as opioids, allowing it to hijack the receptors from the opioids and prevent the signal from continuing to be sent. This can save lives. Last, we have reuptake inhibitors. These prevent or delay the reuptake of neurotransmitters into the axon terminals, allowing the neurotransmitters to stay in the synapse for longer to continue to interact with receptors and send signals. An example of these are selective serotonin reuptake inhibitors, or SSRIs, like Prozac and Lexapro, which are common antidepressants. With more serotonin being allowed to stay in the synapse for longer, there can be increased interaction with receptors and signals being sent to increase mood, which can help combat depressive symptoms.
Don't be fooled. Sometimes drugs can be cool.